Assalamualaikum viewers, I am Professor Dr. SMA Erfan, a colorectal surgeon. Today I have come before you to talk about a disease of the anus. As you know, I have been practicing surgery for more than 30 years and have been specializing in colorectal surgery for the past 10 to 12 years. Currently, I am conducting research on laser proctology, which involves treating various anal diseases with lasers, and I have achieved great success in this field. You may know a little about lasers. The main advantage of this treatment is that there are no cuts or wounds and the patient recovers quickly. Usually, surgeries for anal diseases are performed by cutting open the abdomen, which is quite painful. There can be bleeding and discharge, and it takes time to heal. But with lasers, that is not the case. So we will discuss laser surgery in detail later. Today we will discuss a very complex disease of the anus, anal fistula or fistula-in-ano. What is fistula-in-ano or anal fistula? A fistula is an abnormal tract or channel that usually starts from inside the anus and opens up somewhere outside the anus. It has two openings, one is usually inside the anus and the other is outside. In some cases, both openings can be inside. So this tract, which goes from the inside to the outside, is usually caused by something like a boil forming around the anus. Then, when that boil is either operated on or bursts on its own, the pus, fluid, blood, and other substances inside come out. But even after coming out, that tract does not heal because it has a connection to the inside through a channel. Fluid, blood, and pus from inside the anus enter and come out through the outer opening. Sometimes stool or even gas can come out. So this tract is very disturbing and annoying for the patient. Usually there isn't much pain. It hurts for a short time, but it is very disturbing. Fluid comes out, pus comes out, clothes get spoiled, and one cannot pray properly. The only treatment for this is surgery. The surgery is also very complicated because it requires cutting the anus, and if the cut is not made properly, another serious problem can arise, which is incontinence. If the anal sphincter is cut too much, the patient cannot hold their stool and keeps defecating. This is a very big complication. So its treatment is quite complex, and the recurrence rate of this disease or the failure rate of the treatment is very high all over the world. It depends on the complexity of the case. We classify fistulas into high level, low level, and other categories. So the purpose of this classification is to determine the complexity and the problems associated with it and to treat it accordingly. So when pus or fluid comes out from any part of the anus, or if there is an opening, or if pus or fluid comes out from inside the anus, then it is a fistula. Its only treatment is surgery. The surgery is done by cutting or through various other methods. Now we are performing that surgery completely with lasers, and our success rate is almost 100%. So we will talk about these issues and treatments in the next episodes. Stay with us and learn more. Thank you all.